So this is your CuraCator device that you developed.
Correct.
To better, more effectively, and more safely apply PRP. Because what is the concern with applying PRP without the CuraCator?
I'll show you, because you know a picture's worth 1,000 words. So can y'all move a little closer? I hope everyone can hear me. Is that better audio now?
Yeah.
Perfect. Okay, so if you can see on my patient, she's just had microneedling. And what we would previously, I need some gauze too. What we would have been doing is these procedures are performed, you know, thousands of them daily around the world. And you'll see the clinicians often do this technique where they've got a needle on the syringe. Now, this is a bloodborne particle, right? So the last thing we want to do is experience a needle stick. I did a survey among my colleagues, and 14% of the colleagues that responded to my survey, which were dermatologists and plastic surgeons, had experienced a needle stick in their practice doing this technique. We're dripping it onto the patient's skin. Now, if y'all can zoom in closer, if you can see that that's coming out of the needle, it's dripped onto her face. Now I'm going to take my gloved hand and I'm going to rub it. Now, if you watch, and you can see, this is literally dripped down to her ear by now.
Yeah.
People think, you know, they're pretty good at doing this, and I mean, we all are, you know, professionals here, but you see this dripping technique, that it's literally running down her face, it's gotten to her ear. And now I'm having to use my gloved hand to smear this over her face.
Right.
So the danger is the needle stick risk 14% amongst dermatologists and plastic surgeons. Not only that, we're wasting product because I'm squirting it, I'm losing some of it as I'm smearing it. And it's, you know, on my glove now. Have we adulterated the platelets? We don't know. So because of these risks, one thing we'll do is take the needle off. And this is another technique people use where they're actually using an open-ended syringe to drip it. Oh, even worse, a lot of drip, and we're losing product.
Right.
So
and then
because of the waste, because of the dripping technique, I was inspired to come up with another method that I needed in my clinical practice. So that's where the CuraCator comes in. So
and then a lot of people are asking what are the benefits of PRP and what's in PRP?
Correct. Okay, I'm gonna finish the demo with the CuraCator, and I'd love to answer the questions about PRP. So this is the pouch. It's got a single-use only sterile CuraCator device. I'm basically gonna just open this packet, and the CuraCator is a disc. And now I'll attach this onto the syringe. Now, if you can see, now we have a disc, and now the product comes out in little small increments, and now I have a safe and controlled application of PRP onto her freshly microneedled skin. So there's no dripping, there's no wasting, and it's hands-free, it's needle-free. It also is a better experience for the patient from their perspective. And I know, you know, I've been on the table, I'm sure many of y'all have. You don't want to feel uneasy when some product is dripping down your cheek and into your ear when you just had your treatment done. So this allows clinicians for safety, control, application. Now, what are the benefits of PRP? Why are doctors all around the world and clinicians using this as part of our treatment protocol? Well, that's based on the science called autologous cell therapy, meaning our body has different ways to help heal. So platelets, if you think about what their role is in the body, they're circulating around all day with our red blood cells and white blood cells. What the platelets' job is I compare them to the American Red Cross worker or the emergency response team, okay? You get an injury or a wound, say it's a little scratch or a cut. Well, the platelets' job is to immediately stop bleeding. But then they have over 300 granules within a platelet that are proteins. We call them cytokines, we call them growth factors, and they're essential for healing. So in the 70s, actually, it started in Spain with an orthopedic surgeon who said, gosh, you know, we're having people with torn ligaments and tendons. Why don't we take advantage of the body's ability to heal itself? And so he actually started PRP injections for athletes and people who had orthopedic injuries with ligaments and tendons. And then that segued into dermatologists using PRP for stimulating new hair growth will commonly inject PRP into the scalp. The great thing with the CuraCator is since we're wasting so much less product than the dripping technique, we often have enough left over that if our patients also want us to inject their scalp to boost new hair growth, absolutely. So now we have enough to do these PRP facials with our microneedling and our laser resurfacing. And as an add-on procedure, we can inject it into their scalp if we want to boost new hair. But the reason, again, we're using platelets is their ability to deliver these proteins, growth factors, and cytokines to our freshly wounded tissue to speed up healing as well as boost collagen production.
So it's like liquid gold in a sense.
That is definitely one of the terms we love to use about it, some liquid gold. And
Yeah,
again,
and so you don't want to waste it.
You don't want to waste the liquid, right? And so,
Right.
again, with CuraCator, we're minimizing and eliminating a lot of the risk for waste. We don't have to worry about needle stick, and we definitely are. It's a sterile product, so we're not contaminating the tissue as well. So
Right.
I want to do a few more demonstrations. Let's switch gears. Kelly's going to kind of go ahead and finish up here. So again, since we're not wasting our platelet-rich plasma dripping it down the face, now we are going to have more product to work with. So, for example, with Regen Lab, with this PRP company, we have these syringes with up to 6 mLs of PRP. Actually, it looks like we may even have yielded a little bit more in this situation. With their data, it shows that their yield is going to be over 85% active platelets in the spin once we spin it, which is a 1 5-minute cycle, which is really great because I think in the past I've had PRP kits that we had to spin for up to 20 minutes. And now with this new Regen Lab, we just have one spin that's about 5 minutes in length. So that's getting us time to get our patients ready and prepped. So what else can we do with this platelet-rich plasma? In my practice, based on some data that I read out of a French article a few years ago, I'm also injecting it directly into the skin. I don't know how many of you may have had some injections for the lower eyelid tear trough. That's a real popular procedure in dermatology where patients will have that little dark circle, which is basically a separation between their lower eyelid fat pad and their medial cheek. And what we're doing with hyaluronic acid fillers is we're using that HA filler to inject into the trough. But sometimes, if patients have really thin skin, maybe see just a little shadow, or maybe that filler binds a little too much water. So one of the techniques is to actually blend PRP with one of the HAs. So we can do that, and basically then we're getting the immediate fill effect of an HA. But because we hyper blended it with PRP, it's not going to be as dense, and maybe it's not going to look as puffy if they do have fluid retention or swelling. And then also by injecting the HA with PRP, we're going to also get that extra boost of collagen production. So I'll demonstrate that on Denise if y'all want to see that procedure.
Yes,
Let's go
that would be great.
Yeah. How you doing there? Good. Okay, great. My beautiful mom.
And when Denise had microneedling, and a lot of times you apply PRP after microneedling or laser treatments. Why is that?
I'm sorry, can you repeat the question?
Denise had microneedling.
Yes.
So a lot of times PRP is applied after a laser treatment or after a microneedling treatment.
Correct.
Why is that?
Well, again, that's because we're using the platelets to boost the healing process. So we just purposely wounded the skin to make those little micro channels so she could get improvement of her epidermal layer as well as a boost of collagen in her dermis. So because we've created these little micro pores of purposeful wounding with microneedling, the PRP, when we apply it, is to help enhance the healing process. So she'll heal quicker. There's been some split-based studies done that show the PRP side could heal quicker than the side that was microneedled but not treated with PRP after. And then we have some data that shows you can actually see enhancement and a little bit more boost of neocollagenesis. Neo meaning new, collagenesis is the production of collagen. So that's the term we use in medicine to indicate that we've made more collagen in response to these treatments. So again, the microneedling achieves a lot of these goals, but when we add the PRP, we're enhancing the improvement as well as speeding up the healing process.
We keep getting a question here. Does it help with old scars?
Absolutely, yeah. Matter of fact, one of the best indications for microneedling will be acne scars or old surgical scars or even stretch marks. Now, behind me, I've got my Photona laser. I'm a huge advocate of this device. I'll often do what we call fractionated micro lasering. I'll choose between microneedling versus my quote micro laser based on whether or not I need heat. The laser generates controlled, purposeful heat, and that'll go actually deeper into the tissue, down into the mid-dermal layer, especially with this device and what we have called subablative settings, where we're actually generating heat into the dermis, and that's going to help build more collagen as well as stimulating some elastic tissue formation and tighten up the existing collagen bundles. So if I've got a patient with more skin laxity, I'll often choose a fractionated laser treatment where we're combining subablated settings with our fractionated settings to get more tissue tightening. But if it's someone who's got really good, pretty good firm skin or acne scars or just stria, we can do microneedling. And that's going to do, again, the purposeful wounding, but no heat. So microneedling, no heat, which is one reason it's good for all skin types. Although the Photona laser, we can choose whether or not we're generating heat on high, medium, or low, or we can just go cold with no heat at all because this laser's quite advanced and allows us to tweak and fine tune even things such as delivery of heat. But those are both techniques in science that we use in dermatology to rejuvenate the skin, and absolutely great for old surgical scars, old traumatic scars, new scars. We often will start treating a new scar 6 weeks after suture removal to make it just blend and fade away. And then, of course, as I mentioned, acne scars as well as stretch marks. Yeah.
So you can use it anywhere on the body that you're having these types of
Yeah,
treatments.
absolutely. And what's actually a very cool new technology that we're using is microneedling along with PRP to stimulate new hair growth. Gosh, in my practice, we have about 5 different treatments for stimulating new hair growth. Back 6 years ago, I always say we dermatologists could only play defense. We would use things like minoxidil and finasteride to help prevent further hair loss. But we would often tell our patients, you know, hopefully this is just going to maintain what you've got. But we didn't usually see a lot of new growth. And that changed again about 5 or 6 years ago when we started using PRP and we got FDA clearance in the US. Now in Europe, I mean, this dates back 2 decades. They've been using PRP to stimulate hair growth and enhance healing, for 2 decades. But the U.S. was a little bit behind getting the FDA clearance on these kits and these PRPs that we use now. The emerging new autologous cell therapy, it's called exosomes. I'm a big fan of exosomes. They're happening. They're the little messenger that we send directly into the tissue to stimulate those stem cells. Kind of still based on the science of PRP, autologous cell therapy, getting the body to regenerate itself. But with exosomes, these are made in the lab and you don't have to go through the venipuncture. But right now, the FDA is only saying apply them topically, do not inject them. So one thing we're doing back to microneedling is microneedling the scalp to stimulate new hair growth and using PRP in conjunction with that or the exosomes. Back to the hair growth, again, as I mentioned, we used to just play defense, protect the hair from falling out further. But now with PRP injections, with microneedling, and with my Photona laser, we have a setting called scalp lace. We're literally using light energy to stimulate new hair growth. And that's based on science we call photo biostimulation. Photo meaning we're using light, and of course bio, the biology of stimulating new hair growth. And it's kind of a cool science. If I've got no time, I'll just digress. If you've ever had laser hair removal, we're using super high power laser energy to pulse over unwanted hair growth to ablate the hair follicle. But about maybe a decade ago, people were noticing that if they weren't getting treated on a high enough setting for hair removal, then they actually started growing more hair. So if the clinician was trying to be super careful, if the patient had dark skin, and they were going with a low energy setting on the laser, well, it wasn't strong enough to destroy the hair follicle. So as a paradox, the patient started growing more hair. which wasn't cool when you were trying to get rid of unwanted facial hair and you came back with a beard. But the scientists also said, aha, if we're not putting enough energy to destroy hair, but we're getting enough energy to stimulate hair, we've got to investigate this further. And what they did find is that if you deliver low energy light to the level of the hair follicle, you could activate dormant stem cells and grow new hair. So now we're lasering scalps on a completely different setting to stimulate new growth. Same laser, switch to a different handpiece and a different wavelength of light, we can destroy unwanted hair. So
and when you look at the before and after pictures and you see new hair growth in places where there wasn't, it's really, you know, outstanding. So
yeah.
I can see why you would want to save your precious PRP or your precious exosomes, which are very, you know, expensive, from
Yeah,
dripping down your
right.
neck, and then you can't use them in
Right.
other
And
areas.
that's with the CuraCator, absolutely. I mean, like, that's the key, is we don't want to waste a drop, because each drop is probably worth, you know, several bucks. So especially if you look at, you know, an exosome could be several $100s for a vial. PRP is pretty cost effective for most people. That's within their budget. But again, you don't want it dripping down your ear, down your neck, and you certainly don't want it splattering into your eye, your patient's eyes. And then you want to eliminate that risk of a needle stick. So the CuraCator takes care of all those concerns, and again allows it to have enough product to let's inject. Let's show you the injection technique. Okay, we get everything situated. We probably have to reposition our ring lights, which I'll shout out to my friend Michael Somanak in DC, who taught me years ago to only do videos with a ring light. Okay, so I'm going to put my patient down a little bit lower. So Denise looks great, but at the same time, we want to maintain that, right? We want to keep her looking wonderful for eternity. And so what I'll do now is demonstrate using a micro cannula, not a needle, to inject the PRP. We'll go ahead and start with her nasolabial fold, and then I'll show the technique for the lower eyelid trough. How are we doing on our time, everybody?
We're doing good.
Okay, great. So again, we have our PRP and our syringe, and then we have these micro cannula. You can get both my CuraCator and these micro cannula on Airtight. I don't know if most of you have accounts with Airtight if you're a clinician watching this today, but that's a medical supply company that carries both the CuraCator and micro cannulas. You can order both of these from that company. Are there any more questions right now?
Yes. Would every provider have your CuraCator device?
We launched literally, I got on podium last August to announce that I, you know, developed this product, and we introduced it to the medical community. So we're 1 year out, and very excited to say we've got, again, I mentioned Airtight, now distributing and carrying the product for clinicians to order directly from them. It's available on our website, CuraCator.com, and you can order it off of Shopify. And then also Henry Schein, which is another major medical supply company, has just recently picked up CuraCator as well. So hopefully CuraCator will be in everybody's medicine cabinet before long, because it is the best way to deliver product to skin.
I have to say, every aesthetic provider that I've mentioned it to or shown it to has just thought it was amazing and ran to order it. So,
well, I needed it. I couldn't find it either. So, you know, here we go. It was a 3-year manufacturing process. Step 1 was filing a patent, and that was done in October of 2019. And then I contacted a medical manufacturing facility, worked with them for about 18 months on design and development. We went through, I mean, believe it or not, to come up with this design, we went through 9 prototypes. I had 2 engineers and a fluid flow physicist work with me.
wow.
So, I mean, it looks quite simple, but there's a lot of science and technology that went into it. And right now it's, you know, lure lock, so that can be attached to any syringe that's the lure lock. We use 3 ml syringes, sometimes a 1 ml. A 5 ml, it can also be used with that size syringe, but I think 3 gives us the best, obviously, control when we're doing these procedures. In addition to that, I did have with the fluid flow physicist validation that we can put products of different viscosity. So PRP is obviously very liquidy,
Right.
but we can do creams, ointments, or gels. Often after these treatments, and we'll do this before we finish with Denise, we'll put sickle fate. That's a great product we use to finish our procedures with. It's very soothing, very calming. We send patients home with a syringe with the sickle fate in it and a CuraCator. And I tell my patients, do not touch your face or your skin that we treated for the next 2 days. Instead, use the CuraCator attached to the syringe to apply sickle fate. And that way they're not touching their skin either.
Right.
Yeah, we want to keep hands off, right? Hands free. So it's kind
Yeah.
of like the fork, right? We used to eat with our hands.
Yeah.
And now we don't. We use forks.
Right.
Yeah.
Safer, more effective, and more sophisticated.
Perfect. Oh, I like that word, sophisticated. Okay, so using a micro cannula. Let's see, can you move the armrest? Hang on one second, people. We're going to get this situated. Okay, so we've got a micro cannula. Now, these look like needles, but they're not sharp on the end. I first learned about micro cannula about 6 years ago. One of my dear friends and colleagues, Susan Winkle, came back from a meeting in Paris and introduced another friend of mine, Dr. Hooper, and myself to these micro cannula. So they're not sharp on the end, they're blunt. Now, we do have to start with the little intro needle. So I'm going to come right here. Are we zooming in a little bit? We're going to try to zoom in.
And if you're just joining, we're talking about PRP application. And Dr. Hopkins is demonstrating a PRP injection with filler.
Tiny, can y'all see this? So that's the little intro needle. If you're someone who gets kind of woozy, this might look quite scary and ouchy, but she's numb. So with my little bitty intro needle, now I'm gonna come in with this micro cannula. And I'm in. And I'm gliding up. Now, injections are really important to know landmarks. So this is a highly vascular area on the face. The last thing you want to do as an injector is inject into an artery. That's going to cause embolism, and that can then result in skin necrosis or blindness. So that's one other benefit of using a micro cannula is because they're blunt, they are less likely to puncture into blood vessels. Now, I said less likely. I didn't say they won't. So I'm still going to aspirate. I always tell patients if they're having injections done, they need to first ask their injector if they know what aspiration means and how to do it. If they don't, get up and run. Okay, so I just aspirated. I had no backflow of blood, and I'm just putting a little blanket of this PRP into Denise's nasolabial fold. Now, this is not going to be quite like a dermal filler or HA, which I love. I'm kind of obsessed with them. But at least since she's already got the liquid gold, we can put it into this deeper layer of the skin, again, to just boost some neocollagenesis. And it's a really great little technique. We could certainly blend it with HA. I love that as well. Now, vertical lip lines, that's something we all female patients, actually I did a lecture on that in Barcelona, Spain a few years ago at the 5 Continental Congress meeting. And women are prone to get vertical lip lines where men are not. And the reason is they have hair and they have big hair follicles and have good blood flow, and we have thinner skin. So women, even if they don't smoke or drink out of a straw, which I don't recommend you drink out of a straw or smoke, I highly recommend you don't.
Right.
But one of the other techniques I love with my micro cannula, are y'all getting a good view? Is I'll actually come right up underneath the skin. I'm really more superficial. And I use this little micro cannula to break up these little fibrous bands that hold the skin down. So we call that tethering, and those vertical lip lines get tethered. So by using the micro cannula to basically, we call it subsize, I can break up those little fibrous bands, and then immediately they get a little lift without even having to inject directly into a wrinkle. I don't even inject directly into vertical lines anymore. I do subcision with the micro cannula, and then I lay down a little blanket of PRP and or HA.
So this injection that you're doing right now is just strictly her PRP.
It is, yeah.
Yeah, and then it's the PRP left over from
the
putting it on her face topically after a microneedling treatment.
Correct. Yeah. Now, some people will say, well, I just drip my PRP with the micro cannula. Well, that's not what they're intended for. And again, you still don't have the control. We'll just demonstrate. Look, it squirted there and there, and I'm still going to have to wipe it. And it ran down her neck. So messy technique. Don't do it. Get a CuraCator. Make your life easier. Make your patients happier. Take care of them.
And then someone asked how long the PRP injection lasts, but it's not like filler where
No,
you're going
it's
to
not.
get the plumpy look for months.
Right. So with PRP, when I'm injecting it, I mean, we're basically going to see a correction because of the volume that it's putting in. But we'll need to make sure the patient knows that after about a week or two, they may be a little disappointed because the skin settles. And then, we're waiting on the collagen production. So and Denise, if you look at her, she really doesn't have lines or wrinkles. She's, super lovely. But we're using this more for preventative for her. Kind of a prevention against aging. But if I had someone with more significant lines or wrinkles, I would absolutely incorporate one of the hyaluronic acids, like a Restylane product or the RHA collection. I love that new filler from Revance. So you could add that
the
into
redensity.
Yeah. And again, you got to look at your patient's budget. What are they? What are our goals? What's their budget? How can we best get there? I say most of this is like, we're going to get to the end point, but just which car are we going to drive in? So we prefer to be in the Bentley or the Mercedes, but sometimes we have to, take a different route.
But I love that this really demonstrates that you are getting, you could have a secondary treatment with what you're saving by using the CuraCator device. And maybe you don't need filler on your visit, but you can repurpose what's left behind for a secondary location or another treatment.
Because see, I've still got, after we did the PRP facial, I've still got 1.5 mLs, and we're not going to throw this away.
No.
We're going to put it somewhere, right, people?
And if you're just joining us, that's from her own platelets, from her. You extracted her blood. It went through a centrifuge, and then the platelets that came out of it are what it has growth factors. It's what you're using.
Exactly. So her body's on peptides, growth factor, or not peptides, but on growth factors and cytokines.
Yeah.
And
so I personally
I
wouldn't want to waste it because I don't want someone to take more blood.
I know. I mean, I will say behind the scenes, we just had a little bit of effort this morning to get the venipuncture and get some blood going. So yeah, once you've gone through the needle stick and you're already paying for this, I mean, let's put it somewhere. We didn't waste any of it because we used a CuraCator to control the application in the PRP facial. So,
and then let me ask you, if you have a microneedling treatment or a laser treatment, and you mentioned these microchannels that are opened up now, is there a window of time that you then need to put the PRP on?
Absolutely.
When does that window close?
That's a good question. I think our window is going to close within probably 24 hours. We're starting to re-epithelialize. That's another point. These patients will hop up off the table, and we don't want them to put their hands on their face. I mean, we don't want makeup on after this for a good 48 hours at least. So we do need to appreciate that the skin is now wounded and it's going through a healing process. We purposely did it, and it's going to be great, but we do need to appreciate that. So I would say, within that 24-hour window, you want to already have applied your PRP. Now, PRP is not, you can't just put it back in the refrigerator and use it later. 4 hours is the window for PRP. So, she's not going to sit here for she is, because she works for me. She's going to come back to work with this face today. We're going to use her as our model all day long. But the window for PRP would be 4 hours. But you could certainly, and we do, send our patients home with their residual. We give them a fresh CuraCator. We put it in like a little sterile pouch, and we tell them, for the next 4 hours, use what's left to reapply to your skin. And they're comfortable doing that. Now, could I send them home with a needle or an open-ended syringe, I would not, because messy, dangerous. And then if they're at home trying to squirt it on their face from a needle or an open-ended syringe, the patient's going to battle the same thing we were battling in the office. It's dripping, it's splatter, contamination would be my biggest concern, and waste. But definitely contamination would be a risk. And now, you know, a sterile CuraCator, we put in a little pouch, and we send them home and we say, don't touch your face, just, you know, put a little dab of this or a disc of CuraCator derived PRP onto your face, and she can go home and do that the rest, you know, for the next 4 hours.
I have a few questions asking where you're located, Dr. Hopkins. You are in Monroe, Louisiana, and
I've got
South Lake.
I've got 2 locations, Tatiana. I've been in Monroe, Louisiana, in the northeast corner of the state for 26 years when I opened my practice right out of residency. And by the way, none of this was even a thought in anyone's mind in 1996. Right. We had collagen back then, but hey, something cool. We actually had Botox. I remember being a resident and we read the article in May of 1996 on the novel use of an abobotulinum toxin for glabellar frown lines. And the next month, our faculty ordered Botox. We trained on it, injected each other in our cosmetic dermatology clinic. In July 1996, I started my own practice in Monroe, offering this off-label use of botulinum toxin, aka Botox, for treating wrinkles on the forehead and frown. So jump forward 26 years. We're still doing neurotoxins. Now we have 4, and now we're doing these really cool things that science has allowed us to appreciate and learn about. So never stop learning, people. It's always important. My second location's where I am right now. That's South Lake, Texas. It's right outside of Dallas and Fort Worth. I opened my office here, gosh, we were going to 16 months ago, so it's my baby. And over here and in my Monroe office, we offer all the same treatments. I'm very thankful and blessed to have a great staff. I've got Jeanette, my physician assistant, aka the audiovisual filmer. She's filming the whole thing. And then in Monroe, I've got 2 outstanding nurse practitioners, one of whom is my niece, Anna Grace, and then Rachel Head is the new nurse practitioner. And lots of great laser techs offering these really great laser procedures we offer, as well as these microneedling treatments. So, yeah. So either location, you come see me and meet my team, and we can do some fun things like microneedling with CuraCator's technique.
Well,
do we have time?
It's just amazing that out of your experience, you know, performing PRP and doing research, and we spoke before going abroad to you know, present at conferences, that you gathered all this information and you created something that really is helping patients and doctors. And
well, thank you, Tatiana. I appreciate it. And to explain the name, people have asked me, well, CuraCator, at first it kind of doesn't roll quite off your name. Initially, I was going to name it Applicare, but that one was already trademarked. So I sat down one morning with a cup of coffee and a notebook and started, you know, just putting words and things together. And I looked up the Latin root for cure and care and concern, and it's cura, C-U-R-A. So cura is the Latin root for cure, care, and concern, and it's an applicator. So CuraCator became the name. And then our company is called Trinovations. My husband came up with Trinovations, and Trinity, you know, the Father, Son, and Holy Ghost, and it's an innovative company. So we got our names together with that.
Amazing. And can you tell everyone again where they can purchase CuraCator?
Yes, absolutely. So currently you can go to Airtight. So if you've got Airtight rep, you can call them. If you don't have an Airtight rep, you can go to their website, and Erin can certainly help you out with that. Or you could go to CuraCator.com, which is my website, and there's a link there to our Shopify. So it's available for purchase. And oh, look, we'll do this. It'll be fun. We'll do a discount code for everyone watching on Instagram Live. Let's see, we'll make it NewBeauty. NewBeauty. So if you go, give me an hour to get this code active. But yeah, if you're watching and you want to order some CuraCators, we'll do like a little discount code called NewBeauty, all caps, one word, and you can order it today and get your little discount code for spending your coffee hour with me this morning.
Perfect. Thank you so much for joining us this morning, Dr. Hopkins.
Thanks.
This has
That's fun.
been really informative. And
Thank you.
when you go and get your PRP or your exosome therapy, don't forget to ask your provider if they have the CuraCator.
Perfect. Thank you. All right.
Thank you.
Everybody. Have
Have a
great
wonderful day and a good rest of your treatment.
Thank you. I appreciate it. Take care.
Bye-bye.